Nabila, one of our patrons and real inspirations for Together for Sudan. It's a privilege to welcome you here. Tell us where we are and what you've been doing this morning.
We are in some area, very far area here in Omdurman, and we are working in one of the schools corresponding to Together for Sudan. And we have screening about 110 or 4 students and some of the people from surrounding areas. We have a very interesting cases today. I would like to mention one of the girls. She has some very low vision and squint, so we will treat her and then she can return back to the school. And also there is another child. She have a febrile illness, and then she lost her vision, but now she started to regain again. Really, it is wonderful that we come to the patient where they are, so we can help them a lot. Thank you for Together for Sudan Women's workshop now. Thank you for Peter and Penny. Thank you for all the people working with us.
We thank you for what you do. As you just talk a little bit more about the work you've done over many years, I'm going to just move the camera around, but you keep on talking, and
yes,
it gives
sir.
the kind of description
Yes,
of what
yes,
you've been doing.
Yes, I'm working now since 2002. I'm working with Together for Sudan. I have moved around Khartoum and outside Khartoum also. I went to Nuba Mountains. I did about 4 outreaches camp there. I worked here in Khartoum State and Omdurman and Bahari. We have already went over more and more areas now for more than 12 years. In the past we are doing 4 outreach, but now according to the less of funds we are doing just 2. But I hope we can return back to do 4 per month, because the people, they are really in need. We have met a lot of interested cases, and we have met with a lot of the patients. We regain the vision for them so they can return back for their work, and they are not overloading the community because they are blind.
Our eye care outreaches are so important for women, because without sight they cannot do literacy and they cannot help their families properly.
The women, they are really in need for this eye care, because if the woman, she couldn't see, so she cannot move in her house, she cannot learn her children, so it's completely broken family when the woman, she has some eye problem.
And to remind those who haven't met you, and I've had the privilege and the honor of meeting you, your work in Khartoum is at a senior level, lecturing and working with students. What is it you actually do in Khartoum? You are a...
Yes, my name is Dr. Nabila Radi. Yes, I'm graduated from Faculty of Medicine, Alexandria University in 1979. I'm graduated for University of Khartoum by mastership in ophthalmology in 1985. So I am a consultant since 1985. I have my subspecialty in orbital tumors and oculoplastic. I'm working for teaching the postgraduate and the undergraduate student. I am in a level that I am not that I cannot have a time for this charity work, but my charity work, it is inside my blood, so I cannot stop doing such a charity work.
And we are so delighted about that.
Yeah.
I've met some of your students in Khartoum, and you are a mother to them. You inspire them, and the medical students do research projects in ophthalmology because of your inspiration.
Yes.
And we meet you not in the center of Khartoum in an elegant restaurant, but out here in the places where life matters, for improvement, for conditions. And you can see these little children here are just so enthusiastic to at least say hello to me, and if I wave to them, they will wave back. You're going to wave back?
Yeah.
There you are.
Yeah.
So we've got children waving, but most importantly we've got Dr. Nabila, who is an inspiration and a medical inspiration in this amazing place. Dr. Nabila, thank you on behalf of Together for Sudan for everything you do, and we will pledge to support you and increase that support in whatever way we can.
Yeah, I can give another small message for the people outside and the message for the people inside.
Right.
That the medicine or the medical work, it is a giving and a charity work. I don't forget my partner, colleague. She is suffering like we are suffering. Is the her. She is going with me closely together in each outreach place. I would like to thank for everybody. He feels that this charity work is very important for the women's education and Together for Sudan. Thank you, Peter, and thank you for your coming to Sudan.
Well, thank you. The pleasure is mine and the honor is mine. And I move here, Izdaha, to just say thank you for all you do as one of our loyal supporters. Thank you. We are blessed.
Surely.